Tourette syndrome is a neurological condition that often starts in childhood and is characterized by repetitive, involuntary movements and vocalizations called tics. There is strong evidence of a genetic component to Tourette syndrome. It tends to run in families, and specific genetic variations have been linked to this disorder. Tourette syndrome is associated with abnormalities in the brain structure and function, particularly in regions that control motor movements and suppress tics. Neurotransmitters like dopamine play a role in the development of tics. Some environmental factors, such as prenatal exposure to certain infections or toxins, may increase the risk of developing this syndrome in genetically susceptible individuals. Tourette syndrome is characterized by two primary types of tics: motor tics and vocal tics. Motor tics are repetitive, involuntary movements. Specifically, there are simple motor tics, which include blinking or head jerking, and complex motor tics, which can involve more coordinated movements, such as jumping, twirling, or touching objects in a specific sequence. Vocal tics are repetitive, involuntary vocalizations. Simple vocal tics may involve throat clearing or sniffing. Complex vocal tics can include words or phrases, echolalia, which is repeating others' words, or coprolalia, which is involuntary swearing or inappropriate language. Many individuals with Tourette syndrome experience premonitory urges, which are uncomfortable sensations or feelings that precede tics. These urges are temporarily relieved by the performance of tics, but they often vary in frequency and intensity over time, depending on factors like stress, anxiety, or fatigue. While there is no cure for Tourette syndrome, several treatments and strategies can help manage the symptoms. Comprehensive behavioral intervention for tics is a form of behavioral therapy that focuses on identifying tics and learning to manage them effectively. CBIT can help individuals become more aware of their tics and develop strategies to reduce their frequency and intensity. In some cases, medication may be prescribed to manage severe tics or co-occurring conditions like ADHD or anxiety. Support groups provide a platform for individuals with Tourette syndrome and their families to connect with each other facing similar experiences, share coping strategies, and offer mutual support.